Hello everyone! In today's video, I want to share with you a disease that is extremely common in cats under 1 year old and is also a big problem for households with many cats or cat breeding farms because of the terrible spread of the disease. And the disease that I want to mention today is cat flu, or also known as Feline Upper Respiratory Infection, URI. In this video, I will help you understand what cat flu is, the cause of the disease, as well as the symptoms of cats with the flu and how to treat the disease, as well as how you can protect your cat from this disease. And now, let's get to the content of the video. So what is cat flu, and is it dangerous? Coughing, sneezing, runny nose, sore throat, and eye discharge are extremely common in cats under 1 year old, or cats with low immunity system, and these conditions are collectively known as upper respiratory tract infections, or cat flu. In addition, there may be other more serious and less common symptoms such as fever, loss of appetite, fatigue, mouth ulcers, drooling. Some cats may even have corneal ulcers, and the severity of the disease also varies from individual to individual. For many cats, the disease is very mild, with simple treatment, or can even heal on its own without treatment. But for some other cats, the disease progresses extremely seriously and can lead to pneumonia and death.
What is the main cause of cat flu? Most cats with upper respiratory infections are infected with one of two viruses that cause cat flu. But in some cases, cats have both at the same time. It can be Herpesvirus or Calicivirus, and these two viruses are thought to play a role in over 90% of cases of cat flu. The remaining cases are usually caused by two types of bacteria. That is the bacterium Bordetella bronchoseptica, which is responsible for cases of cat sneezing, runny nose, and coughing. And the second type of bacteria is Chlamydophilus felis, which is the bacterium that causes conjunctivitis and eye discharge in cats. How contagious is the disease? Calicivirus and Herpesvirus can spread very quickly between different cats in the litter, and can also be transmitted from mother cats to kittens under 2 months old. The disease can be transmitted through direct contact between healthy cats and sick cats, or it can also be indirectly transmitted through the saliva of sick cats on objects such as clothes, food bowls, drinking bowls, and cleaning tools. The virus can survive for a very long time in the environment, about 10 days for Calicivirus and about 2 days for Herpesvirus. Not only that, cats that have had cat flu, even after recovering from the disease, will continuously excrete the virus into the environment for several months. Therefore, cat flu has become a serious problem for households with many cats or cat breeding farms because it's almost impossible to eliminate the virus from the environment. What are the signs of a cat with the flu? When cats are infected with the Calicivirus or Herpesvirus, the incubation period is usually from 2 days to a week. And when the disease begins to break out, the cat will show symptoms such as coughing, sneezing, runny nose, lethargy, loss of appetite, fever, and eye discharge. For cats infected with the Herpesvirus, the symptoms tend to be more severe, especially the eye symptoms. That is, cats will have conjunctivitis, leading to red, swollen eyes and a lot of eye discharge. And the eye discharge will often be green or reddish-brown. Some cats infected with herpes will also have severe sore throat, leading to loss of appetite and high fever, as well as persistent cough. For those infected with the Calicivirus, the symptoms will be milder. However, some cats infected with the Calicivirus will have ulcers on the tongue or ulcers on the lips and palate. Some other cats will also have arthritis and lead to limping. However, this arthritis symptom is usually mild. It will go away after the cat recovers from the flu. Most cases will be accompanied by other bacteria, and in a few cases, the disease will progress seriously, leading to lung infections and endangering the cat's life. Most cats with the flu can recover very well, However, there is also a fairly large percentage of cats who, after recovering from the illness, suffer from sinusitis. These cats have a persistent runny nose that cannot be cured or can be cured but is very susceptible to a recurrence of the runny nose. This condition is commonly called chronic sinusitis because the lining of the nasal cavity has been severely damaged and cannot be fully recovered.
So how should a cat with the flu be treated? Cat flu is a disease that spreads extremely quickly and often leaves sequelae that cause chronic sinusitis in cats. Therefore, I do not recommend that owners treat cat flu at home without supervision or prescription from a veterinarian. Usually, to treat cat flu, it is necessary to use some antibiotics such as doxycycline, amoxicillin, and some other antibiotics to minimize the damage caused by secondary bacteria. Cats with conjunctivitis will also need to be treated with some antibiotic eye drops, such as levofloxacin, gentamicin, or tobramycin. Some cats have a runny nose and stuffy nose due to too much nasal discharge in the sinuses, so they may need to wash their noses with solutions such as saline, or use an aerosol to loosen the secretions in the sinuses to help them breathe easier. Many cats with the flu have sore throats or mouth ulcers, which cause loss of appetite. Some cats have a runny nose, which makes their sense of smell less sensitive. Therefore, during this period, using soft and fragrant foods such as pâté will be very helpful. And you can also warm the food so that the aroma of the food will attract your cats to eat more. For some cats that have severe anorexia and malnutrition, they may need to be hospitalized for nutrition and intravenous medication. Cats with severe mouth ulcers may need to use some painkillers such as diclofenac or meloxicam to help them eat more easily. Currently, some antiviral drugs are also used by veterinarians in the treatment of cats. For example, interferon, cidofovir, or acyclovir. These drugs are also highly appreciated for their effectiveness and safety.
So is there any way to prevent cats from this disease? Currently, the 4-in-1 vaccines for cats on the market are very effective in preventing the rate of cat flu, up to 70%. Fully vaccinating will significantly reduce the rate of flu, as well as prevent the risk of spreading the disease among cats in the herd. At the same time, if any cat has been fully vaccinated as prescribed by the veterinarian, when it gets sick, the treatment will be very simple and recover quickly, and the symptoms will be much milder than those of cats that have not been vaccinated. Therefore, vaccination is extremely important, and you should give your cat the first vaccination as soon as your cat is 60 days old. And that's all I want to share in today's video. If you find this video interesting and useful, please like and subscribe to the channel to support me, so I can make more videos to help you take care of your pet at home like a professional. Goodbye, and see you in the next video.
Thank you for visiting. We'll see you next time. Oh!